You know, for years we've all heard communication get labeled as a soft skill, but what if that's just completely wrong today? Let's reframe that whole idea, because communication isn't just about being friendly. It's a core clinical competency every bit as vital as knowing how to administer medication or read a chart. And if you need proof, just look at the data. Get this, a study from the Cleveland Clinic found that a staggering 90% of patients feel that effective communication actually improves their satisfaction with their care. That's not just a nice to have, that is a fundamental part of the patient experience. So if it's that critical, how do we even measure it? How can we tell if our communication is healthy or if it needs some attention? Well, let's break down the vital signs of what truly effective, powerful communication looks like in a healthcare setting. All right, section 1, the communication diagnosis. We're going to look at the symptoms and, more importantly, the very real, measurable impact that good and bad communication has on a patient's health. It really all comes down to one thing. First, trust. It's the foundation of everything. When a patient trusts their healthcare provider, they open up. They share the whole story, not just the main symptoms, but the little concerns too. That complete picture, it leads to a much better, more accurate diagnosis. Trust literally improves the quality of the information you're working with. This has a direct effect on a patient's well-being. I mean, just look at anxiety. Simply taking the time to clearly explain a condition, a procedure, what's going on, that can slash a patient's anxiety by up to 30%. Think about that. That's a powerful intervention. That doesn't require a prescription, just a conversation. So we know why it's so important, but how do we actually do it? How do we build that trust and create that clarity? Well, it really rests on 3 core pillars of connection. And these are skills that anyone in healthcare can develop and strengthen. Let's dig into each one. Pillar number 1 is active listening. And believe me, this is way more than just waiting for your turn to talk. It's really a diagnostic tool in itself. It means you're watching body language, you're listening to their tone of voice, you're trying to hear what they're not saying. This is how you catch those little misunderstandings before they become big problems. And the results are huge. The American Association of Colleges of Nursing found that practicing active listening can boost patient satisfaction scores by a full 20%. That's massive. When people feel truly, deeply heard, their entire outlook on their care changes. Now for our second pillar, empathy. Honestly, this is the real heart of it all, isn't it? It's that ability to genuinely connect with what a patient is feeling and to validate their experience. Sometimes just saying, "I can see this is incredibly stressful for you," is the most healing thing you can do. It makes them feel seen and human. Its power is not just a feeling, it's measurable. A study showed that patients who felt their caregivers were empathetic reported a 26% jump in their emotional well-being. Empathy isn't just a soft skill, it's a tool for healing. That brings us to our third pillar, cultural sensitivity. Look, in the world we live in today, a one-size-fits-all approach to communication just isn't going to cut it. This is all about recognizing and respecting that people come from different backgrounds and that a little awareness can break down huge barriers and build that crucial trust. The research from the National Institutes of Health backs this up completely. It found that 1, providers just take a moment to acknowledge a patient's cultural beliefs. It creates a much more comfortable, trusting, and collaborative partnership. It just shows basic respect, and that goes a long, long way. Okay, let's move on to section 3. Modern tools and training. We have these 3 pillars, which is great, but how do we actually build them and put them into practice in today's super fast-paced, tech-heavy healthcare world? I mean, technology has totally changed the game. No surprise, 60% of patients love the convenience of things like telehealth, but, and this is a big but, they still crave that personal human connection. So convenience can't be an excuse to lose the connection. So you can see the challenge, right? It's this constant balancing act for everyone in healthcare today. You have to use the technology, the electronic health records, the streamlined info to be efficient, but at the same time, you have to provide that personal engagement that meets a patient's fundamental human need to be heard and understood. So, how do we get better at this? It's not magic. There's actually a playbook. It starts at the top with organizations making communication, training a real priority. Then you put that theory into practice with things like role-playing for tough conversations. And finally, you keep that growth going through mentorship, where the veterans can guide the newer folks. Okay, so what happens when we actually do all this? When we really invest in these skills and training? What's the ultimate result? Well, it turns out it creates this amazing ripple effect that benefits everyone in the system. What a ripple effect it is for patients. It's pretty clear. Better health outcomes and way less anxiety. For nurses and other providers, it means higher job satisfaction, less burnout, and more career success. And for the whole system, it builds an environment of trust and collaboration. It is a win-win-win. This quote really just nails it, doesn't it? By investing time in these skills, nurses can enrich their careers while positively affecting patient care experiences. It's not just another box to check. It's a direct investment in yourself, your career, and most importantly, in the people you're caring for. So as we wrap this up, I want you to just take a second and think about your own practice. Of those 3 pillars, active listening, empathy, and cultural sensitivity, which one could you focus on strengthening starting today? Which communication pillar will you choose to build on first? Thanks so much for watching the Communication Clinical Skill. If this video helped you, give it a like and share it with your classmates. For more nursing and medical skills videos, don't forget to subscribe and hit the bell so you never miss a new lesson. See you in the next one.